everyone. Thanks for coming. I'm Dr. Adrian Edgar. I've been the medical director at Clinic 554 over the last 9 years. I just prepared a statement. So this past weekend marked the 36th anniversary of the decriminalization of abortion in Canada at the level of the Supreme Court. Prior to 1988, providing safe abortion was criminalized and only permitted in limited circumstances, making it difficult for patients to obtain this health care. And though we'll never know the actual number of people who sacrificed their lives and health as a result of the then lawful barriers to safe and timely abortion care, estimates show that tens of thousands of abortions still took place, despite what were then considered legal restrictions. Nowadays, New Brunswick remains the only province in Canada that continues to legislatively restrict patient access to safe, local, and timely procedural abortion care. New Brunswick is the only province that legislatively strips its patients of their choice in abortion care. New Brunswick is still the only province that illegally undermines pregnant patients' control over their own bodies. Under Regulation 8420 of the Medical Services Payment Act, patients in New Brunswick are denied access to abortions outside hospitals. This means that despite what should be every Canadian citizen's right to access universal health care, patients in New Brunswick cannot just come to Clinic 554 and present their Medicare card in order to see the doctor. Only in New Brunswick does our government force them to pay out of pocket for their health care instead. This policy is a punishment for being pregnant in New Brunswick if you are not ready or able to be so. This policy is a New Brunswick-specific tax on having a uterus. This policy is a sexist, discriminatory, anti-scientific, and long outdated indictment of any woman or gender minority in New Brunswick who exercises their sexual and reproductive rights and freedoms. And in Canada, we are offended when our government behaves unfairly or treats some of us like second-class citizens. But today, I'm asking New Brunswickers to be more than offended. We need to be outraged. This year should have been the 10th anniversary of Clinic 554 providing the only procedural care outside a hospital between Quebec and Newfoundland. This year should have marked the 30th anniversary of New Brunswick's continuous access to the type of abortion care we deserve in a community setting with a dedicated team of local, expertly trained, kind, compassionate, and trauma-informed abortion providers here in Fredericton. But instead, 2024 brings the sad end to New Brunswickers' access to this level of skilled and tender-hearted, state-of-the-art care. As of today, procedural abortions will no longer be available at Clinic 554 in Fredericton, and patients living in the capital region or south of Moncton will no longer have local access to this health care. While our Premier has taken New Brunswickers to court to decide to what degree this regulation violates the Canada Health Act and our charter rights, our building was put up for sale and our rent was set to double. And in the absence of what should have been universal coverage provided by our provincial government for every patient to receive this essential and medically necessary health care, Clinic 554 has had to rely on donations, to work without pay, or to abide by the province's policy of offloading the cost of healthcare onto patients at an ongoing financial loss for our team. Healthcare cannot be provided in a financial vacuum. This has never been an acceptable or sustainable way to be forced to provide healthcare in Canada. But it is what our provincial government insists on doing to New Brunswickers. Because Clinic 554 never turned a patient away regardless of their financial, citizenship, or Medicare status, and now, without reliable access to an affordable and suitable space to provide this level of care, we can no longer continue to do so. And New Brunswickers find themselves without out-of-hospital abortion care for the first time in 30 years. In an effort to avoid delays in patient care, we have secured a donation to continue to answer calls and faxes at our current toll-free numbers, 1-855-978-5434 and 1-855-978-5435 respectively, but only for the next month. We will continue to direct patients and colleagues to appropriate care pathways via those lines during this time. In the meantime, we are eager to work with any interested partners to try to address the gaps our closing will leave behind. We are most concerned about patients for whom travel or a medication abortion is not an option due to financial reasons, mental health or addictions reasons, disability, age, financial or housing precarity, legal status, or freedom of movement and personal security. But under the misogynist misguidance of our current Christo-fascist premier and some sycophants in his party, I believe New Brunswickers will not only continue to be denied the same fundamental healthcare right of every other Canadian, but we will continue to see an erosion and a further dilapidation of our health and social welfare services under the present government. We have already seen that New Brunswick has fallen well behind the national curve on access to procedural abortion, and we know that some New Brunswickers are forced to accept medication abortion in the absence of the choice to access procedural care locally. This is an inconceivable reality to exist in this day and age, and it is unacceptable for our province to allow the expertise of our skilled healthcare providers to go unutilized while patients are left to suffer in this way. We need to see today's announcement as a wake-up call. Unconstitutional regulations and barriers to abortion care have no place in Canada. Our provincial government cannot be allowed to continue to rob its patients of their legal right to health care and bodily autonomy. Our Premier has a legal duty to ensure abortion care be provided without barriers, but he chooses to perpetually fail to do so because he cannot separate his intolerance from his duty. Today, Canada is one of the few countries around the world without federal laws restricting abortion, but our provincial government still insists on banning it in its safest location. We are calling on every New Brunswicker to speak up now. Your right to abortion care is enshrined in law, and it should be equal for all Canadians, no matter where they live, their immigration status, or how much money they have. This egregious loss of health care is just the beginning of what I fear this provincial government has in store for us, and we cannot afford to sit back idly while we lose our health care rights. Thank you.
My name is Sophie Lavoie, and I'm a representative from the wonderful organization called Reproductive Justice New Brunswick. Reproductive Justice New Brunswick is deeply saddened by the news that by February 2024, Clinic 554 will no longer provide abortion care. We are grateful for the years of hard work, passion, and advocacy the staff and volunteers have provided since the clinic's opening in 2015. This marks the end of 30 years of procedural abortion care in the Capital Region since 1994, when Dr. Henry Morgenthaler opened a clinic in Fredericton and began providing non-judgmental, accessible, safe abortion care. It is devastating that after 30 years of work and advocacy, we are losing a vital healthcare service. We are deeply concerned by the impacts of the loss of this essential healthcare. For years, Clinic 554 has been filling the gaps left wide open by our current reproductive healthcare system, accepting referrals from the hospitals and providing pro bono abortion and contraception care to those who simply can't afford it. Clinic 554 is the only freestanding clinic providing out-of-hospital abortions in the province and in the Maritimes. We are losing a dedicated service providing timely trauma and violence-informed care, often serving those that the hospital system has failed. Clinic 554 served people beyond the hospital's gestational age limit, people without Medicare, such as asylum seekers or international students, people who use drugs and are unhoused, people in precarious work, people without care, and minors without supportive parents, among many others. Clinic 554 has always met the needs of many, but in particular, those already marginalized and excluded from our current healthcare system. The persistence of Schedule 2.A1 of Regulation 8420 of the Medical Services Payment Act is the foundation of this loss. With just the stroke of a pen, our Premier could remove this restrictive, unconstitutional regulation and fund procedural abortions outside the hospital setting. The government has recently removed similar regulations governing other procedures such as cataract surgery, which are now funded by Medicare when performed outside a hospital setting. Regulation 8420 has been maintained by successive New Brunswick governments, allowing misogyny to continue restricting abortion care in our province to the detriment of the patients. We extend our deepest thanks to the staff, volunteers, and numerous advocates who fought for 30 years to maintain procedural abortion care in the capital region, with a particular thanks to the services provided by Clinic 554 since 2015. RJNB demands that the New Brunswick government remove Regulation 8420 of the Medical Services Payment Act and fund procedural abortions outside the community setting. Lives depend on it. Thank you.
Good afternoon. My name is Mary Milliken. I was recently a research coordinator on a project about abortion access in New Brunswick, and I have been an erstwhile RJNB member for several years. We are this is on behalf of the primary investigators from the project. We are deeply saddened about and concerned by the closure of Clinic 554. This is an incredible loss for the community who rely on the abortion care provided by Dr. Edgar and his team. Despite regulatory barriers, Clinic 554 has remained a site of certain and inclusive procedural abortion care in a province where misinformation and stigma, as well as numerous logistical barriers, can hamper patient access to procedural abortion in the hospital system. Data shows that these barriers to procedural abortion care are felt most deeply by those living in different forms of structural marginalization, including poverty and racism. While the staff at Clinic 554 has provided many healthcare services during its almost 10 years of operating, they provided more than 1,000 procedural abortions between 2015 and 2022. This includes more than $52,000 worth of pro bono abortion care. Let that number sink in. Dr. Edgar and his team ensure that those who come to 554 get the care they need. We call on the province to immediately repeal Regulation 8420A.1 and to provide comprehensive public funding for all abortion services and clinical practices across the province. Abortion care, as the research team continues to state, must be inclusive, certain, local, and free. Thank you.
My name is Teresa DeVore Hall, and I work with the Madhu Verma Migrant Justice Center. The Madhu Center is alarmed by the news of the impending closure of Clinic 554 in Fredericton. Our organization, like so many others who work with marginalized communities, relies on Clinic 554 and their invaluable services. The clinic staff have provided a safe, non-judgmental, and welcoming space for members of our community, particularly for those who are uninsured. Abortion services in hospitals are not available to these members of our community. Uninsured people must deal with stigma, racism, and xenophobia when accessing services. When they do access health care, they risk being forced to pay large hospital bills. An emergency room visit for an uninsured person in New Brunswick costs over $600. The reality is that abortion services are far from accessible for all New Brunswickers. The closure of Clinic 554 will mean that the people we work with will suffer. Our organization joins New Brunswickers in calling on the provincial government to scrap the regulation that stops the funding of abortion services in clinic settings and immediately fund the province's only abortion clinic that provides abortions outside hospitals and specializes in treating two-spirited LGBTQI+ people and other communities that are marginalized. The devastating impact of Clinic 554's closure will be felt most greatly by those who are already left behind. Thank you.